Welcome to the CCRN GI practice review questions. This video is for questions 1 through 10. Let's get started. Question 1. Your patient was admitted 2 hours ago with hypovolemic shock secondary to a GI bleed. The origin from the GI bleed is his esophageal varices. Which intervention is not appropriate? A. Administer sorbitol if the patient has a history of cirrhosis. B. Monitor closely the patient's neuro and respiratory status. C. Prepare the patient for emergent surgery. Or D. Place scissors at the bedside for the patient's esophageal balloon. And the answer is C. Prepare the patient for emergent surgery. Banding or sclerosing of the esophageal varices will address the bleeding. However, this isn't considered surgery, rather an endoscopic procedure. All of the other answers are appropriate. Question number 2. The following answers are true in the setting of liver failure, except for A. Pancytopenia may be due to liver failure. B. The development of hepatic renal syndrome is related to high mortality. C. A GI bleed will increase the serum ammonia level. Or D. Alcohol abuse is the leading cause of acute liver failure. And the answer is D. Alcohol abuse is the leading cause of acute liver failure. This is because alcohol abuse is the leading cause of chronic liver failure. Acetaminophen is the leading cause of acute liver failure. All of the other choices are true. Question 3. Your patient was admitted for acute generalized abdominal pain that was dull in nature, accompanied with diminished bowel sounds, and a low-grade fever. An hour later, your patient now complains of more severe pain that worsens with his movements. Now, his bowel sounds are absent, and he has a rigid abdomen. What should you prepare for next? A. Insertion of a nasogastric tube. B. Surgery. C. Increasing the patient's pain medication. Or D. Administering antibiotics. And the answer is B. Surgery. This is because the patient's clinical presentation is that of peritonitis, and treating the patient surgically will help reduce the increased morbidity. The other choices will help treat the patient, however, not urgently. Question number 4. You have a patient you are admitting that suffered an assault from which an individual used a metal pipe. You assess your patient to have ecchymosis to his left flank. You determine that your patient most likely has which of the following? A. Hypocalcemia. B. A ruptured spleen. C. Hemorrhagic pancreatitis. Or D. Retroperitoneal bleeding. And the answer is D. Retroperitoneal bleeding. The flank ecchymosis is indicative of Gray-Turner's sign in the setting of recent trauma. This may have led to retroperitoneal bleeding. Although Gray-Turner's sign may be due to acute hemorrhagic pancreatitis, the patient's trauma is the more likely etiology. The other choices do not match Gray-Turner's sign. Question number 5. You admitted a 41-year-old female patient 20 minutes ago with a diagnosis of an acute bowel obstruction. What is your most primary concern? A. Hyperkalemia. B. Aspiration. C. Metabolic acidosis. Or D. Hypovolemia. And the answer is D. Hypovolemia. In the setting of acute bowel obstruction, sequestration of fluid to the vascular third spaces can be life-threatening and is generally worse in small bowel obstruction. Aspiration can be a risk, however, it is less serious than the risk of death from hypovolemia. Question number 6. Which of the following answers are not true in the setting of acute pancreatitis? A. Left atelectasis with accompanying left diaphragm lift. B. Hypercalcemia secondary to the autodigestion of the pancreas. C. Hyperglycemia secondary to the beta cell injury. Or D. ARDS secondary to the destruction of type 2 alveolar cell injury. And the answer is B. Hypercalcemia secondary to the autodigestion of the pancreas. It is hypocalcemia that is prevalent in the autodigestion of the pancreas during acute pancreatitis. All of the other answers can be present. Question number 7. Your patient complains of acute epigastric pain that radiates to her back. She has been vomiting for 11 hours and she says her pain is worsening, not getting better. She does report use of alcohol, but does not remember how much. Her lips are cracked, has poor skin turgor, with a tender and distended abdomen. Her vitals are BP of 91/51, a heart rate of 132 a minute, and her respiratory rate of 30 a minute. You notice her hand spasm during her blood pressure assessment. What does this indicate? A. Metabolic acidosis due to hypoperfusion. B. Hyponatremia due to overhydration. C. Hypoalbuminemia due to protein loss. Or D. Hypocalcemia due to fat necrosis and calcium precipitation. And the answer is D. Hypocalcemia due to fat necrosis and calcium precipitation. This is a clinical picture of acute pancreatitis. Hand spasms are a sign of hypocalcemia, which occurs during pancreatitis. The other choices do not result in the hand spasms. Question number 8. You suspect intra-abdominal hypertension developing in your patient due to his recent development of hypotension, decreased urine output, and a rising BUN and creatinine level. Which of the following should you do? A. Elevate the head of bed to 45 degrees. B. Withhold the patient's opioid pain medication. C. Measure the bladder pressure. Or D. Remove the patient's nasogastric tube. And the answer is C. Measure the patient's bladder pressure. The history of trauma, the requirements for fluid resuscitation, and the patient's cardiovascular and renal dysfunction suggest this patient may be experiencing increasing intra-abdominal pressures. Measurement of the bladder pressure and subsequent correlation with the MAB should reveal the approximate abdominal perfusion pressure that will help direct the patient's therapy. Question 9. Your patient is receiving enteral nutrition through a small bore feeding tube. Which of the following interventions are appropriate? A. Ensure the patient's head of bed is 20 degrees. B. Assess for the placement of a feeding tube with an air bolus. C. Discontinuation of tube feeding if diarrhea develops. Or D. Mark the exit site with a marker. And the answer is D. Mark the exit site with a marker. The marking can be used as a reference point for correct placement. An air bolus is not indicated, as this increases the patient's risk of GI complications. The other choices are not evidence-based practice. Question number 10. Your patient has a history of hyperlipidemia and alcohol abuse. He reports left upper quadrant abdominal pain, with his current vitals being a temperature of 101.2 orally, a BP of 84/52, a heart rate of 115 per minute, and a respiratory rate of 24 per minute. What lab values will best reflect the patient's condition? A. Decreased hematocrit and increased lipase level. B. Decreased serum amylase level and increased white blood cell count. C. Decreased sedimentation rate and elevated calcium level. Or D. Increased AST and an increase in LDH. And the answer is A. Decreased hematocrit and increased lipase level. The patient's condition closely resembles acute pancreatitis that may be hemorrhagic in nature, causing the hematocrit to drop. Also, in acute pancreatitis, the serum lipase also increases. That's it for this video, guys. Thank you for watching. Be sure to watch part 2 of the CCRN GI practice questions. Also, please visit lifelongnursing.com for more great content. Remember, learn everything.